So we are live and welcome to Let's Do Lunch, a monthly program hosted by AARP, Florida, and ElderSource, the Area Agency on Aging and Aging and Disability Resource Center for Northeast Florida. I'm Linda Levin, CEO of ElderSource, and welcome.
Hi, I'm Justine Conley with AARP First Coast, and each month AARP and ElderSource team up to share with you a variety of educational and often entertaining topics. We have fun and we help you stay connected to important information that keeps you informed, hopefully happy and healthy. And welcome to Let's Do Lunch.
Great. Thanks, Justine. This month, we focus on the maze of Medicare enrollment. Open enrollment can be a confusing time for many people, and sometimes don't you wish you had someone to help you? Well, today we have that person, John Rissler. He is one of our several Shine volunteers. Welcome, John. Let's start with the first basic question. When is open enrollment, and why is this an important time for people over 65?
Well, thanks, Linda, and hello, Justine. Thank you for having me on again. And open enrollment is now. It started on October 15th. It runs through December 7th. And during this time, Medicare beneficiaries, whether they're 65 or older, doesn't make any difference. Some disabled have Medicare at under 65. And they review their coverage. They can change their coverage. They can add coverage. They can fit the coverage to their current needs, because over a year's time, things change in our lives. And this gives them, everybody, an opportunity to make new choices.
Wonderful. There's so much to know about Medicare and doing open enrollment. So what we know is that you are a Shine volunteer. Tell us what Shine is and what the program is about.
Shine is serving the health insurance needs of elders. And in your training for Shine, you learn to memorize that on day one, because everyone wants to know what Shine is. We are a SHIP also, a senior health insurance program. It's a nationwide program. Every state has one. We call it Shine because we already had a SHIP. And so we put something in, it was more like Florida. Anyway, we're volunteers and we're funded by the Agency for Community Living. It's a federal agency that hardly anybody's heard of. But they do that through grants through the Florida Department of Elder Affairs in Tallahassee, and on down through ElderSource, which acts as our managing partner. And they set up the structure under which we work. We offer free, unbiased, objective counseling to people on how to select a plan, what each plans offer, what plans are in your area, what plans fit your particular needs. We talk about Medicare savings plans, ways that you can apply for financial assistance to pay some of the premiums, especially your Part B premium. We also offer advice and help in applying for a low-income savings plan. This helps you with your drug premium, your Part D, and some of your drug copays. Those last two items are needs-based, and so it's not for everybody, but we offer that to everyone because they may be needs-based, and we don't know till we talk to them.
So talking about you don't know until you talk to them, John, where do you start when you are talking with someone, and what should they have on hand when you begin? What should they bring with them to the conversation?
Well, first of all, I first start by asking them to tell their story. What's your issue? And that sometimes can take a long time. It's a risky question to ask them to do. But then I want to find out from them what coverage they currently have. Okay. So, and I asked them to do that by showing me their insurance cards. So you should, if you're going to go to a Shine counseling or going to do it on the phone, you should have your Medicare card, any of your Advantage plan cards or your supplemental insurance cards, your drug plan card, anything that has to do with medical insurance, your VA card, your TRICARE card, have all that available. That way we don't spend a lot of time looking for it. And number two, we know exactly what you have. We're not guessing at it. Some people even have programs from their former employers. So they have a card, not too many people offer, retiree medical, but some do. So that's what we need to know right off the bat. And that's how we get started.
Should they also bring their list of doctors or medications? Because I know some plans cover certain things while others don't.
Right.
That's really good.
Medications, everybody should have a medication list in their purse or wallet because you never know, you might end up unconscious at an emergency room and they'll look through there and they'll find it and they'll know what they're dealing with. So I recommend everybody have that on their person. But it's important to know the medications because we can put that into our computer system, Medicare.org, and we can use that to cost out the cost of those medications under various plans.
Okay, great. And while we go on to the next question, Justine, we want to remind everybody who's watching you could put a question into the chat and we'll get those answered by John while we're on the call today. So absolutely. Thank you. And John, thanks for that answer.
Yes. And so again, remember we're live and we are so grateful that you are here. Put your questions in the chat and we'll try to get them answered for you. So John, here's the next question. So I know that you are a Shine volunteer and volunteers do not try to sell you insurance. But how do you help the person decide what is best for them? And I think you touched on a little bit in your last answer, but I just want to say it over and over again that you do not, and as a volunteer, do not try to sell people insurance or even try to tell them what they should do. So talk a little bit about that.
No, any decisions that are made by the beneficiary. And in our pre-discussion agreement with them, we have a written agreement. Ground rules, we make it clear that they hold us and all the other agencies harmless. It's all these decisions are theirs. I don't even tell my relatives when I do this for them what to buy. I let that be all for them. So basically, we here's how we do it. We ask a general income question. All right, do you make more than $1,500 a month? For a single person, that's a cutoff for a lot of the needs-based things that we offer. So we just ask it that way. If it's a couple, it's around $2,250, something like that per month. Okay. And based on that answer, then we move forward. Are you married or are you living with your spouse? Because if you're living with your spouse, these needs are all joint income. Okay. So then I usually ask them, how often do you access medical providers? I mean, some people are frequent users. They go every 2 weeks to this one or that one, or they go to 6 different doctors for everything under the sun. Okay. And then there's other people who says, I haven't been to a doctor in 5 years. Okay. So they need different insurances. They need a different kinds of coverage because of their circumstance. And then I ask people, how much choice do they want? How much choice in providers? Do you want to go to Dr. Smith or Dr. Jones, or do you care? Some people don't care. So that's a type of insurance they can get into, an HMO, in which they go to an assigned first primary doctor. Mm-hmm. And from then on, it's whatever the HMO sends them to. Okay. Other people are very picky and they want to know who it is. They want to go to the best guy in the town or best woman. All right. So we ask that. Then I asked, do you have a regular doctor? Okay, that's important because we need to find out what insurance they take. And that's the next question. And how do you find that out? You call the insurance person at the doctor's office. Okay, not the front counter. You ask for the billing person. They know what coverages they cover. Okay.
Absolutely.
And then finally, we take our computer or we can do it manually, go to Plan Finder on mymedicare.gov or Plan Finder in medicare.org.gov, I'm sorry. And we can put all this information in there, push a magic button, and they'll put out, 25 plans that are in our area for Advantage plans. Because the person has to initially make a choice between original Medicare, a supplement, and a drug plan, or an Advantage plan, which is everything all rolled into one, provided by an insurance company.
Mm-hmm.
Okay, so you have to decide, and a lot of that depends on their income.
That's a lot of information, but that's such a great help. Such a great help. There are ways to save money in Medicare, right? What are those?
Yeah, well, don't plan on saving a lot because Medicare is not free.
Right.
A lot of people think it is, as they get to be 64 and they get surprised, and it's not free. There are several Medicare savings plans available based on need. There are 3 basic levels, and they pay the premium and the co-pays in various amounts. We'll get into real details here for Part B of Medicare. That's your doctor bills, testing, non-hospital related costs. Because for most people, the hospital Part A has already been paid for through your taxes as you worked. It was taken out from your pay. So there are ways there that the government can subsidize those premiums for Part B. Currently, this year, it's $148 and change. I haven't seen the new number for next year. I tried to look it up this morning. I don't think it's out quite yet. If it is, I missed it. Anyway, that's one way. The other way is a program called Low Income Subsidy, or LIS. That pays some of your drug costs, the premium for your drug plan, and some of your co-pays. All of those programs are needs-based, okay, based on your income. And not only your income, but your assets. So it's, stocks, bonds, the gold under your bed, the oil wells in Oklahoma that you didn't tell me about at the beginning of our talk. So anyway, they're all needs-based, and that's how you can save some money.
Should we take the question from the audience right now, Linda? So Here's a question. It says, can I get a person to help me get 4 meds covered for my daughter who is homebound and gets Medicare? I missed the Part B sign-up time. She doesn't qualify for Medicaid due to amount in savings from SSI.
And I think she's asking about IV medication.
IV. It's IV, I thought number 4. I thank you, Linda. IV meds. Thank you. That's why we're a team. I'm like 4 or IV? IV meds.
IV
Thanks,
meds.
Linda.
Sure. We hear that all the time in our world. So,
so thank you.
Go ahead, John.
Well, that's okay. I think she should call the number and get in a queue and get assigned to a Shine volunteer who can go a little deeper in here as to when she missed the Part B sign up, because you can sign up for Part B almost any time. There are some penalties for that, for late sign up, but given the situation with her daughter and her her financial situation with Social Security, those are things we need to explore a little further. But I think a Shine counselor would be glad to help her with that.
Excellent.
We saw that number come across.
Yes.
But let's put that up there again, 1-800-96-ELDER or 1-800-963-5337. anyone who has a Shine Medicare question, wants to talk to a counselor about that question or any question you have, call that number.
And thank you for your question, because it's a great question. And thank you for the answer, John. So here's our next question, going not a different direction, but I'm sure something that you see oftentimes in your work. It says scams are a big deal right now, targeting older adults. Many older adults are being scammed. What should they know and do to protect themselves? We hear that a lot in AARP. And I myself have been called and harassed on the regular basis. I'm not even old enough yet, but yes. So talk to us, John.
Well, the scammers are out there, and the seniors are most prone for it. And what I want to talk about is Senior Medicare Patrol. It's another group of volunteers connected with Shine, and I'm involved with that here in Northeast Florida. And we help people with that issue by teaching them to protect themselves, to detect the scammer, and to report what they've found. Okay. First of all, guard your Medicare number and your card like it was a credit card, because in the hands of a scammer, it is like a credit card. He can use that number to bill Medicare for all kinds of services not provided and get paid. And you say, well, why would Medicare keep doing that? Well, they get millions of claims every day, and they can't possibly screen out everyone. So some of them get through, and the scammers take advantage of that to the tune of billions of dollars. We're not talking small change here. All right, so that's the one thing. Guard that number. And that means don't carry it in your wallet or your purse. Take it out. Put it in a little plastic holder. Put it in a safe place at home. When you go to the doctor, or take it with you. Okay? Or when you go to a face-to-face Shine meeting with a counselor, take it with you. But leave it at home otherwise, because you don't really need it. Emergency rooms will treat you without a card, and they'll take care of the billing later. Okay? When somebody else brings the card down. Okay? So don't give out your Medicare number over the phone. First of all, Medicare, Social Security, the FBI, none of those people will call you on the phone. They don't do that. They send letters, okay, old-fashioned way. So if someone wants your Medicare number over the phone, it's a scam, okay? If in doubt of the caller, call your primary doctor. Find out, say, hey, can you call me back, or can I call you back? Or when you hang up on them, call your doctor and say, did you tell them to give me a test so-and-so? And if they haven't, now you know you've been scammed. And once you realize that you've been taken because it sounded so real, and even your own doctor's name was mentioned in the call, okay, don't feel bad. Don't feel embarrassed. Report it. Call the number on your screen. That same number will get you to someone like me, and we'll research it with you, gather documentation, and send a report to the authorities that can do something about it. Okay. That's Senior Medicare Patrol. There are 3 major scams that are running currently. One is called cancer DNA swab, and that's where they take a swab from your cheek, and they claim that they could tell you your propensity to get cancer. Okay, and wouldn't you like to know? It's a legitimate test, okay, that Medicare allows once.
In your whole life?
Once.
Wow.
And so if you let a scammer do that test, and they won't ever tell you the results, okay, then you've blown your Medicare benefit for that test. It's not a very common test for people, but the scammers make it sound terrific. The second one is cardiac DNA testing to your propensity to have heart disease. And it usually starts with, hello, I'm Joe, and I'm wondering, how's your blood pressure? Do you have high blood pressure? I could be a real big help for you. Well, I don't know the percentage of the population over 65 that has high blood pressure, but it's probably pretty big.
Right.
And so He's already got you hooked right there because, oh, yeah, I got high blood pressure. So he'll say, well, your doctor recommended you take this test. Again, it's a scam. They want your number and they will bill Medicare. The last person I had that happen, they billed Medicare $8,000.
$8,000?
Right.
Wow.
Medicare allowed about $6,500 or a little over, maybe close to $7,000, and they paid it.
And no benefit to the beneficiary. They didn't benefit from that.
Never came. There's no test results.
Wow.
The other one is called body braces. They'll call and ask if you have arthritis. Again, high percentage people do, and they will send you braces until you have 8-9 boxes on your front porch. UPS will be coming every day, and they're billing Medicare for all the braces. And let me tell you, some of the braces are complex and quite expensive.
And you don't need them.
And you don't need them.
And you didn't ask for them.
Looks like we have a question on the screen.
Yes.
Yep. It went away.
It went away.
So while we wait, here it is. My dad is in a nursing home with Alzheimer's. The facility's doctor has put him on a prescription that is not covered by his Medicare plan. Is there a plan I should enroll him in that will cover the cost?
Great question.
Okay, and the answer is maybe. There might be a plan. You might want to review during open enrollment, review his plan for drug coverage and look for other plans. The drugs in the Advantage plans and even in the drug plans are tiered. You have tier 1, 2, 3, and 4. And then you have some of these that are not covered at all. Okay. And those are your best to do is to contact the manufacturer. If you look on the prescription, find out who made it, get on their website, okay, and look for patient assistance plans. Many of the drug manufacturers have patient assistance plans for low income or not even low, but tight income situations. That's one alternative. So you can either change plans to one that covers it, or you can ask the manufacturer for some help, or lost the number 3. Oh, you could ask your doctor for a different medication that might be similar. Okay, in this case, it may not be because of Alzheimer's. The other thing you could do is get into a study. See if you can get into a trial. In the trial, you may get the placebo, but you may not. And some trials are even, you're going to get the drug and they just want to see how it's going to react. So trials will get you free drugs too.
Great. Thanks, John. While I'd wait to ask you my next question, I want us to put that number up there again for people to call, whether you have a concern about a fraud incident. And John said, don't be embarrassed. This is happening all the time, unfortunately, and not just to you, but we want to stop it from happening to the next person. So call that number, whether you have a Medicare question or a fraud concern, and you will get connected with one of our very skilled Shine volunteers, SMP volunteers, who will help you. So, John, is there anything else you feel is important for our viewers to know about Medicare benefits and open enrollment? What else would you like to share?
Well, I see a question in the chat room. I'm going to go there now and answer that one because it's important. It says, after open enrollment ends, after December 7th, do you have another opportunity to make changes, or are you stuck for a whole year? In most cases, in high percentage of cases, you're stuck for the year, okay? Because these insurance companies base their whole business model on a year's worth of coverage, okay? However, there are some unusual circumstances that occur. You may move, okay? And so you may move outside of your insurance coverage area. So you get a special enrollment period. You may, I'm trying to think of it. I had it right on the tip of my tongue there. Another one. Your plan may go belly up. Okay, it happens. Sometimes Medicare disenrolls the plan because of their bad business practices or fraudulent practices or whatever. So if you lose your plan or you change location, you get a special enrollment period. Other than that, you're pretty much stuck in what you are. But a Shine counselor, if you get in that situation, call us during the year. We're working every day, 12 months a year. Call us and we can figure out whether you've got a special exemption or not.
So we just want to encourage you. We still have a few minutes left. If you have a question that John can answer, John, you are so knowledgeable and so helpful. Every time we do this, I'm not the age yet, but I learn things. It's like, oh, I need to do that too. Okay. So there are so many people out there who think that they're stuck now and that, well, it's too much work. I don't even know where to start. So tell them again where they can start with the Shine counselor. And that's free and open during the whole year.
Yes, call the toll-free number. You'll get connected. It may take a day or two because it goes through a call center and into a computer and into my emails or my call sheet. So it may take a day or two, but we're more than willing to help you go through the plans, pick a plan, help you decide what you need to do. And that's it. That's the big thing, is for you to call and to do it now, because as we get closer to December 7th, our call numbers go up and our volunteers get more tired. And so it pays to get to us early. You get the best advice that way. And because the coverages that you pick now will start on January 1st.
That's helpful to know. Here's a question. Do you need to be 65 or older to use Shine services?
Absolutely not. We welcome anybody who's contemplating retirement and approaching age 65, or we appreciate those people who are on disability. If you go on Social Security disability, you have to wait 2 years to become Medicare eligible. But as you become eligible, you may find a Shine counselor very helpful in getting you the right kind of coverage.
Wonderful. Well, John, as always, you have been most helpful. And so we thank you for a great program today, because it's been very helpful. And we hope we've helped some people out there. And we're going to put the number up again before we leave. So we encourage you to join us next month for Let's Do Lunch, third Thursday at 12:30. Linda Levin of ElderSource, and I am Justine Conley with AARP, and we will be here again next month. And for you, we put the number up again for the Shine counselors. So thank you for Let's Do Lunch, for joining us.
And if you want to view this program again or check it out later, or let other people know about it, they can view it. You could view it on our Let's Do Lunch programs. Tune into ElderSource's YouTube channel or the AARP Florida channel. And till then, till next time, you can keep going back, call our Shine number, and we'll see you next month.
Thank you. Thank you again, John.